Women's Health Pregnancy After 40: Top tips for handling headaches during pregnancy. Pregnancy is hard enough without having to deal with headaches on top of everything else. The first trimester usually has headaches known as pregnancy headaches, and they can be hard to deal with on top of the tiredness and morning sickness. Of course, when you are pregnant there is very little that you can take to get rid of the pain and not risk hurting your baby. Below, you will find 4 tips for handling those pregnancy headaches and getting at least a little relief. Drink lots of water. Many times, pregnant women just don't get the amount of water they need. You should be sure that you are drinking at least 8 to 12 ounces of water a day. Your headaches could be because you are becoming dehydrated and need to drink more water every day. Carve out a safe haven. Peace, quiet, and a stress-free environment are extremely important when you are pregnant. Pregnancy headaches can easily be caused by becoming irritable, which is something that happens often when you are pregnant. Getting rid of these types of headaches can be as simple as finding a comfortable safe haven to retreat to when life becomes too much. You need to be sure that you get plenty of rest in a peaceful environment when it comes to headaches and pregnancy. Plenty of fresh air is important. Since relaxing is very important when you are pregnant, you need to take long walks to help you relieve stress. On these walks, you will get plenty of fresh air, which in turn will help you prevent those pregnancy headaches. Getting a lot of oxygen to your brain will help to get rid of the headaches before they get too bad. To prevent or relieve mild headaches during pregnancy without taking medication, try the following. Avoid headache triggers. If certain foods or odors have triggered a headache in the past, avoid them. A headache diary might help you identify triggers. Include physical activity in your daily routine. Try a daily walk or other moderate aerobic exercise. Manage stress. Find healthy ways to cope with stressors. Practice relaxation techniques. Try deep breathing, yoga, massage and visualization. Eat regularly. Eating regularly scheduled meals and maintaining a healthy diet might help prevent headaches. Also, drink plenty of fluids. Follow a regular sleep schedule. Sleep deprivation might contribute to headaches during pregnancy. Consider biofeedback. With this mind-body technique, you learn to control certain bodily functions, such as muscle tension, heart rate and blood pressure, to prevent headaches or reduce headache pain. If you'd like to try biofeedback to treat headaches during pregnancy, ask your healthcare provider for a referral to a biofeedback therapist. Most pregnant women can safely take acetaminophen, Tylenol, others, to treat occasional headaches. Your healthcare provider might recommend other medications as well. Make sure you have the okay from your healthcare provider before taking any medication, including herbal treatments. Headaches during pregnancy are common. However, if you develop a severe headache, call your healthcare provider. There are many causes of headaches, including some problems related to high blood pressure. Can a woman over 40 have a healthy baby? Well, there are different therapies. There are a few different therapies that you can try when it comes to getting rid of pregnancy headaches as well. Regular massages have been known to help relieve the stress that causes these headaches quite easily. Aromatherapy is also known to take care of headaches. This therapy uses essential oils to calm the senses and reduce stress, thereby helping with your headaches. Meditation is a commonly used form of therapy when it comes to pregnancy headaches. These are much better to use than the alternative, which is some type of medicine to get the headaches under control. Most mothers do not want to use medicine of any kind, because what you take, your baby takes as well. There are a few medicines that are considered to be safe for the mother and the child when you are pregnant. You will want to talk to your doctor to see which is the right medicine for you, if it comes to that point. Can I have a healthy baby at 43? But let's talk first about pregnancy headaches, which are common during pregnancy. However, that doesn't mean that you just have to live with them. There are things that you can do to reduce the headaches or even get rid of them altogether, just by following the tips above. How many eggs does a woman have at 40? Remember, women are born with all the eggs they are ever going to have, and they don't make any new eggs during their lifetime. Women are born with approximately 2 million eggs in their ovaries, but about 11,000 of them die every month prior to puberty. As a teenager, a woman has only 300,000 to 400,000 remaining eggs, and from that point on, approximately 1,000 eggs are destined to die each month. This phenomenon is completely independent of any hormone production, birth control pills, pregnancies, nutritional supplements, or even health or lifestyle. Nothing stops this inexorable death of approximately 1,000 eggs every month regardless of ovulation, ovarian inhibition, or stimulation. Whenever the woman runs out of her supply of eggs, the ovaries cease to make estrogen, and she goes through menopause. Despite a lot of journalistic hype, there is no similar phenomenon in men. Men continue to make sperm and testosterone at virtually the same rates, with only a very modest diminution as they age. Many population studies have demonstrated over several decades that the average fertile woman becomes infertile by age 40 or earlier, and undergoes menopause by age 50. The mean age of the end of female fertility, according to all the early population studies of fertile women, precedes menopause by about 10 to 13 years. The end of fertility for an otherwise normal, fertile woman, and the age of the onset of menopause correlates strictly with the decline in the number of eggs remaining in her ovary. Greater than what are the risk of pregnancy after 40? This is probably the best known part of the aging equation. The fact is, eggs gradually decline in number and quality as you get older. If you're over 35, you're considered to be of advanced maternal age, with fertility starting to drop most significantly around 32. According to the American College of Obstetricians and Gynecologists, and taking a particularly deep nosedive around 37. By age 44, the chances of spontaneous pregnancy approach zero, said Dr. Jane Van Dis, MD, an OB/GYN practicing in Burbank, California. Of course, reproductive technologies such as in vitro fertilization can help some couples skirt those numbers, but even those efforts can become less successful with age. According to a 2016 report from the CDC, one in vitro fertilization cycle has a 36% chance of successfully impregnating a woman under 35. Whereas it has about a 22% chance for women between 38 and 40, about a 13% chance for those 41 or 42, and about a 6% chance for women over 42. Greater than what are the chances of having a Down syndrome baby at 43? Of course, reproductive technologies such as in vitro fertilization can help some couples skirt those numbers. But even those efforts can become less successful with age. According to a 2016 report from the CDC, one in vitro fertilization cycle has a 36% chance of successfully impregnating a woman under 35. Whereas it has about a 22% chance for women between 38 and 40, about a 13% chance for those 41 or 42, and about a 6% chance for women over 42. Greater than is 47 too old to have a baby? Because longer gestational times can increase the risk of stillbirth, many doctors won't allow a woman over 40 to go into labor past her due date. Generally, she will be given a planned induction. Your risk for other complications increases. As you age, your chances of developing certain cardiovascular problems like high blood pressure and heart disease increase. This is one of the reasons women over 40 are at higher risk for preeclampsia, high blood pressure and protein in the urine during pregnancy, which can be life-threatening, and gestational diabetes, abnormally high blood sugar during pregnancy. These conditions can create a host of problems for both mother and baby, including low or abnormally high birth weights and premature deliveries. Another big problem is an increased chance of developing placenta previa, a condition in which the placenta either partly or fully covers the cervix. Across all pregnancies, 1 in 200 will develop the condition, with evidence suggesting a much higher risk for women 35 or older. Placenta previa is dangerous, and can increase the risk for premature labor and stillbirth. Your risk for breast cancer might change. This was probably the biggest surprise to me. Research suggests that the older a new mother is when she has her first child, the higher her risk for breast cancer. According to Louise Brinton, Ph.D., who was formerly chief of the Hormonal and Reproductive Epidemiology branch at the National Cancer Institute, women who have their first child after 40 may be at slightly higher risk of developing breast cancer in the decade or so following childbirth than those who gave birth before they were 20. The simplistic view is that as you age, your cells are constantly changing, and a heavy dose of hormone can promote them into cancer, Dr. Brinton said. Greater than how long does it take to get pregnant at 40? Age and getting pregnant. Your age is not something you can control. Many women are having babies later in life for very valid reasons, such as not feeling stable enough to support a child, for example, with money or housing. Not wanting to have a child before or not having a partner to have a child with. However, we know that fertility, ability to get pregnant, declines with age, and this decline speeds up after the age of 35. This is because the number and quality of eggs decreases. Male fertility also declines with age, though not as much as female fertility. One study found that for couples having regular unprotected sex, around 7 out of 10 women aged 30 will conceive within 1 year. Around 6 out of 10 women aged 35 will conceive within 1 year. Around 4 out of 10 women aged 40 will conceive within 1 year. After the age of 40, it gets harder to conceive, and you may be offered fertility treatment. Greater than can a 50-year-old woman get pregnant? Improving your fertility. Fertility is affected by lifestyle. There are some things you can do to improve your fertility. For example, if you smoke, it will take you longer to get pregnant than a non-smoker. If you give up smoking now, your chances of conceiving faster will increase. Other things you can do to improve your fertility include being a healthy weight, being active, eating a healthy, balanced diet, cutting caffeine to under 200 milligrams a day, avoiding alcohol, avoiding recreational/illicit drugs, stopping contraception and getting pregnant. Some types of contraception may delay fertility for a while after you stop taking it. For example, the progestogen-only injection for contraception may delay normal fertility for up to 1 year after the last injection. Find out more about stopping contraception. If you take the contraceptive pill, many doctors advise that you should delay trying to conceive until you have had 1 normal period. This helps them to date a pregnancy more accurately. When should I get help with conception? Around 1 in 7 couples have difficulty conceiving. This is approximately 3.5 million people in the UK. Speak to your GP if you have been trying for a year to conceive. Many doctors prefer you to have been having regular sex without contraception for at least a year before referring you for fertility tests. Regular sex means 2 to 3 times a week. You should see your GP sooner if you are over 36. You have a known fertility issue, such as endometriosis or polycystic ovary syndrome (PCOS. Your partner has a known fertility issue, such as low sperm count. You are concerned you or your reproductive partner may have an undiagnosed medical issue that may be affecting your ability to get pregnant. There are ways to help couples conceive if they're having problems getting pregnant. Greater than can folic acid help prevent Down syndrome? Taking folic acid supplements before and during early pregnancy may not only help prevent neural tube defects in babies, but it may also reduce the risk of Down syndrome. A new study suggests there might be a link between the Down syndrome and neural tube defects, and folic acid supplements may be an effective way to prevent both. Neural tube defects are caused by the abnormal development of the brain and spinal cord during early pregnancy. The most severe neural tube defects can cause devastating mental and physical impairment. Numerous studies have shown that taking folic acid supplements before and during pregnancy can significantly reduce the risk of neural tube defects. Down syndrome is one of the most common birth defects, and children born with the condition usually have some degree of mental retardation as well as distinctive physical features. Although the risks of developing Down syndrome are not well understood, the mother's age and family history are known to increase the risk. Researchers say previous studies have shown that mothers of children with Down syndrome and neural tube defects tend to share problems in processing folic acid, which prompted them to see if both defects occurred more often in the same family than in others. The study, which appears in the April 19 issue of The Lancet, compared the number of children born with either defect among pregnancies at risk for neural tube defects or Down syndrome due to a family history of the defects. Greater than is Down syndrome inherited from the mother or father? What causes Down syndrome? Regardless of the type of Down syndrome a person may have, all people with Down syndrome have an extra critical portion of chromosome 21 present in all or some of their cells. This additional genetic material alters the course of development and causes the characteristics associated with Down syndrome. The cause of the extra full or partial chromosome is still unknown. Maternal age is the only factor that has been linked to an increased chance of having a baby with Down syndrome resulting from non-disjunction or mosaicism. However, due to higher birth rates in younger women, 80% of children with Down syndrome are born to women under 35 years of age. There is no definitive scientific research that indicates that Down syndrome is caused by environmental factors or the parent's activities before or during pregnancy. The additional partial or full copy of the 21st chromosome which causes Down syndrome can originate from either the father or the mother. Approximately 5% of the cases have been traced to the father. Does Down syndrome run in families? All three types of Down syndrome are genetic conditions, relating to the genes. But only 1% of all cases of Down syndrome have a hereditary component, passed from parent to child through the genes. Heredity is not a factor in trisomy 21, non-disjunction, and mosaicism. However, in 1/3 of cases of Down syndrome resulting from translocation there is a hereditary component, accounting for about 1% of all cases of Down syndrome. The age of the mother does not seem to be linked to the risk of translocation. Most cases are sporadic chance events. However, in about 1/3 of cases, one parent is a carrier of a translocated chromosome. What is the likelihood of having a second child with Down syndrome? Once a woman has given birth to a baby with trisomy 21, non-disjunction, or translocation, it is estimated that her chances of having another baby with trisomy 21 is 1 in 100 up until age 40. The risk of recurrence of translocation is about 3% if the father is the carrier and 10 to 15% if the mother is the carrier. Genetic counseling can determine the origin of translocation.